Good evening, everyone. So amazing to have so many of you here, and I have to say to see some female faces as well. Not what we were expecting when we said men's health, but I think it's an important conversation for everybody to be involved in. So a very big thank you for joining us here at Lanserhof at the Arts Club. I'm Francesca Okiman-White, and I'm the founder of the Beauty Triangle. Now, we're here tonight in support of Men's Health Awareness Month. I'm sure you'll all agree, a hugely important initiative to really take a deep dive into that, male health. After all, I think with this subject, there's a huge amount that still goes unspoken. You know, whether you're constantly looking tired but getting adequate sleep, maybe it's that your energy levels or your concentration are always fluctuating, or maybe it's just that you need to learn some simple solutions to stress less and enhance your everyday performance. So tonight is really about amplifying the conversation around what it takes to enhance male health and wellness, and also offer you the science-backed solutions that can really help make a change. Now, when we first launched the Beauty Triangle, it was very much to educate and empower our audiences on all aspects of their health and well-being, and always critically from a holistic standpoint, which is why at every event you'll always find 3 individual practitioners that are all an absolute expert in their field of authority. But we also wanted to break down the conversations that are often stigmatized or brushed under the carpet, and in doing so, introduce you to some of the most trusted voices in the world of wellness. Which brings me very neatly, onto our brilliant speakers that we have with us tonight. Starting with consultant dermatologist and founder of Self London Clinic, Dr. Anjali Mahto, GP, functional medicine practitioner and hormone expert, Dr. Sohère Roked, and I hope I get this word right, consultant in exercise, sports medicine, and musculoskeletal medicine, Dr. Sam Botchey. They're all absolute powerhouse practitioners. We're really delighted to have them with us, and really what they're going to be doing is helping us to discuss the science-backed solutions that can help us to keep sharp in both body and mind, whether that's topical ingredients and in-clinic interventions, or it's things like hormonal support and daily hacks. A few quick things to mention before we get started. Hopefully you'll have found a program at your place so you can learn a little bit more about the speakers that we have with us tonight. And we'll also have time for an audience Q&A at the very end, so we'd love you to save up any questions you have until then. And finally, we have an incredible goodie bag for everybody that's here with us tonight from our friends at the Y Code. They've just launched their brand new mattifying moisturizer, which regulates oil production and it supports the skincare barrier, so it's a really nice addition to your winter skincare regime. So I think one that women will actually finally be pinching from the bathroom cabinet and not the opposite way around. And that's enough from me. I'm going to hand over to our speakers. They'll say a very quick hello and introduce themselves, and then we're going to get started with the main conversation. So Anjali, over to you.
Thank you very much, Fran. So I am Dr. Anjali Mahto. I'm a consultant dermatologist. I wrote a book a good few years ago called The Skincare Bible, so talk a lot about skincare, laser, and have a clinic in Harley Street called South London.
Hi, I'm Dr. Sohère Roked. I am a GP. I specialise mainly in hormone health and also in functional medicine and integrative medicine. So that's looking at the best of alternative and conventional medicine and also looking for the root cause. I practice in Omnia in Knightsbridge.
Hello everyone, my name is Dr. Sam Botchey. I'm a sports medicine consultant, work predominantly in health optimization and orthobiologics, which is using your own body to heal itself, and I combine functional medicine in with performance medicine to try and find holistic ways that people can improve their performance in the long term.
Amazing, thank you all 3 of you. I'm so excited to speak with all of you, and I feel like there's going to be such a natural sort of overlap between all of your approaches, so really looking forward to seeing how the conversation unfolds. But I'm going to start with Dr. Anjali Mahto. So she's introduced herself already, but Anjali is one of those dermatologists who I always am constantly referring to whenever someone's skin is having a meltdown. She's encyclopedic in her knowledge of the skin, which is really, really helpful when it's having a bit of a crisis. But Anjali, your dermatology practice is very much split into the medical and the cosmetic, but with your male cohort of patients, when it comes to aesthetics, what are they coming to really see you for, would you say?
So I think this is a great question, actually. If we look purely at the aesthetic arm of the male population, it's always been a little bit slower than the females in catching up. Men usually come when there's a problem, or they've noticed a change, whereas women come preventatively. So your average man will say something like, I just look a bit tired, or my wife has sent me here because she thinks I look younger than, like I look younger than her, as in the wife looks younger, something needs to be done. Or there is some kind of change where somebody is working in a job where their presentation is incredibly important and they feel like the outside doesn't match the inside anymore.
That's a really interesting way of putting it. And when they do come to see you, what sort of solutions are normally sort of the sort of go-to for the men?
So I always start with trying to dig it out of the men to begin with. So one of the questions I will always ask is, on a scale of 1 to 10, 10 being the absolute happiest, the most satisfied you could be with your appearance, your reflection in the mirror, when you looked in the mirror this morning, what would you rate yourself? And I think that the answer that men give to that is actually quite telling. Because if somebody says to you, I kind of feel like a 4 out of 10, the next obvious question then is, well, what would get you to a good 8 out of 10 every day?
Yeah.
And then the answer might be, I'd like to look less tired, or I just feel like I look like I haven't slept, or I just feel like I look older and I want to look fresher, but I don't want people to know that I've had anything done.
It's interesting, you've touched on two things there. The first being people don't want people to know that they're having this stuff done.
100%.
The second, knowing, you know, as we sort of previously discussed, that you are getting adequate sleep, you are performing at your maximum, but then hearing sort of people say, but you don't look well, or you look exhausted, or what's going on, are you sleeping okay? That can really have a detrimental effect on your self-esteem.
Absolutely. And the thing is, we talk so much and we get so much information about female aging, but males and females age quite differently.
Do they? What's causing that? Is it their skin type? Is it their approach to sort of aesthetics and using skincare? Sort of how do you drill down into that?
So I think the first part actually is, if you look at the differences just purely physiologically, biologically at male and female skin, male skin is much thicker.
Yep.
So there is more collagen in the dermis, the deeper layer of the skin.
That sounds nice for them.
It sounds great for them on one hand because it means that they're going to be more resilient to developing fine lines and wrinkles because the skin is thicker. However, the flip side to that is, if you have a man who enjoys outdoor sport, outdoor hobbies, but hasn't got themselves a good skincare routine, isn't wearing their sunscreen, it's all good and well that they might naturally, genetically be aging better, but those lifestyle factors will impact on them more. The second thing is, it's not just the skin that ages as we get older when we look at the face. The skin, and then beneath the skin there is fat, beneath the fat there is muscle, beneath the muscle there is bone. Every single one of those layers changes as we age. And in men in particular, fat distribution happens more quickly and quite differently to female patients. So one of the things that you will notice in male patients much more quickly, fine, they don't have the fine lines and wrinkles, but they start to lose definition in their jawline.
It's the sort of sagging, isn't it?
That's
I hate to
right.
say. And actually, I often hear sort of even the surgeons say that it's the men coming in who are more concerned about their neck. Actually, they don't mind the fine lines around the eyes. You know, actually, all of that can be sort of quite becoming and quite handsome. But actually, it's that loss of definition that just makes you feel a little sort of soft around the edges.
100%. So it's that jawline definition, changes around the neck. You also get changes around the chin area. So often you get a sort of recession of the chin, so the chin becomes slightly pulled back. So the profile changes from the side, but you also get changes in what we call the medial fat pads. So these fat pads on the inner side of the cheek, they descend quicker. So you start to get more sagging of the nasolabial folds in men at a much, much earlier age than you would see in your average woman. Now, of course, there are ethnicity differences. There are differences also in outdoor lifestyle, other kind of environmental factors, but across the board, that is one thing that you will notice with men quicker than you will notice in women.
And what, out of everything you've said, makes treating sort of easier or harder? I mean, sort of things like the skin being thicker, the muscles being thicker, the skin being oilier. What does that mean you can and can't do, or what do you almost advocate then for the male patient?
So one thing I would say, as a general rule that I found with the male patients in clinic, is they're looking for treatments that have pretty much no downtime. They want to have something done. They want to walk out of the clinic and get back to their business and not let anyone know that they actually visited a dermatology clinic. So there are some really great skin tightening treatments. So treatments like ultrasound that you can use. You can zap the neck underneath the chin, all the way up along here, and that can help sharpen up the jawline. It can build more collagen. It can build more elastin. So treatments like Softwave, for example, and this is one that we use a lot in clinic, it does that lifting and tightening, but it doesn't break the skin, which again means you leave and no one knows.
Exactly. It's sort of just restoring the facial architecture to where you want it to be.
Exactly. It's about structure rather than the canvas.
Yes, that's a nice way of putting it. And when it comes to skincare, what are the things that you absolutely advise men to be using, particularly at this time of year?
So I don't think it needs to be overly complex, but I think that if you are a man and you are spending time outside in particular, wearing sunscreen is important. So if you're physically active, you're going to be outside, sunscreen for fair skin types will reduce how quickly your skin will age in terms of developing redness, developing sunspots, and also fine lines and wrinkles. If you have darker skin types, it will reduce the risk of pigmentation changes, so the skin will remain more even in colour. So that's number one, wearing a sunscreen daily, particularly if you're spending time outside. Number two is probably at the very least, probably getting into good habits with using a vitamin A cream, certainly by the time you hit your mid-30s onwards. So vitamin A creams like retinoids can help boost collagen in the skin. Collagen is that main protein that gives your skin its support, its structure, its scaffolding, and topically vitamin A can help build that.
And so that would be your sort of active ingredient of choice. I mean, there's a lot out there for people to choose from, and I think that's obviously where the confusion sometimes sets in, and people then just reach for, if you're my husband, basically the shower gel, and then go, I washed my face this morning. So vitamin A and an SPF.
Absolutely.
Okay, fascinating. What are your thoughts on sort of like a vitamin C or sort of getting an antioxidant in, or is that becoming suddenly too many things to
I
deal
think they're
with?
nice to haves, and I think that once you're in good habits with the absolute minimum, day in, day out, then of course you can look at building on that. But a lot of good sunscreens come with antioxidants, so you could pick one that has actually got those built in, so then you're not multi-layering products if you don't want to do it.
Yeah, exactly. So finding the sort of intelligent formulations as well that are going to do a little bit more for you, those multi-purpose things. When it comes to medical dermatology, what are the things that are really causing a lot of concern for the male demographic that you see?
It's a mixed bag, but we see a lot of acne breakouts. We see a lot of problems with scarring. And that's one thing that's quite interesting, because people that have had acne in their teenage years, often the scarring gets worse and it looks worse as you get older. And the reason for that is, first of all, naturally as we age, we lose collagen in our skin. And when you have acne scarring, you have indents, and that's because you've lost collagen. So those indents that you have from scarring, they sink deeper as you age and as the skin starts to sag, or tissue laxity as we call it. So that's often a common reason that people come to us, actually, funnily enough, saying, I had this problem 20 years ago, but it's kind of bothering me now.
That's interesting, isn't it? Obviously, it's the age sadly setting in, the sort of loss of the plumpness, the sagging, and suddenly the scars are sort of causing an issue where previously they weren't. So I guess obviously getting to the root cause of acne is sort of acne treatment is obviously sort of one of the key things within your clinic as well, just dealing with active acne. And do you still see that affecting men later in life as well? I mean, it can really flare up at any point in time, right?
100%. And I think it's not just the active acne, it's the step before that, the oily skin that can often go along with that as well. So that's another common reason that we do see people, and it is again a case of, can we fix this with skincare, or do we need to do some kind of treatment within the clinic, an energy-based device or whatever it might be that can help pull that back?
Well, what's the tipping point? At what point do you sort of say, okay, we've exhausted the topicals, or is that really a conversation between you and the patient and understanding what their parameters are and what they want to push?
It's quite personalised, to be totally honest, because some people could have a huge skin issue, but they feel not that bothered about it. And then at the other extreme, you've got people that, you know, by definition, it might be in the mild category, but they feel super self-conscious, or their job, you know, you might be an actor, you might be somebody who's on stage. It's really important what your face looks like. You're leading massive teams. And in that case, actually, it is really important that, you know, unfortunately, people judge people by what their skin looks like.
Absolutely.
And having good skin is important to get ahead in life. As much as I don't like that, that is the sad reality that we live in.
Exactly. Look, everything is so visual in society now as well, isn't it? And I think you're right. I think when acne flares up, you know, male or female, whatever time of life it is, it's always quite destructive to your self-esteem. What are the things that you can, so if you've exhausted topical ingredients, things like that, what else can you introduce that might sort of dial up the intensity and help to tackle it?
So I think that would be the point where we could think about laser treatments. So there are laser treatments like Avaclear, which can help reduce the size of the oil glands. So if people have got very oily skin, you can reduce that. If they're getting breakouts, they don't want to take tablets, that's an option.
This is an interesting one, AviClear, isn't it? Because up until sort of really the launch of AviClear, I'd say it was really, everyone just heard, acne and thought Roaccutane.
Yeah, that's right. And I think we're very lucky now that technology has moved so far forward that we have so many more options than just either a cream or prescription medication. We have so much more that we can offer our patients now.
How exactly does AviClear work, and how are you integrating it? Because obviously when it comes to acne, sometimes there's no sort of silver bullet, and even with that you might still need to add in, I guess, topicals or maybe a little bit of Roaccutane and sort of layer it in that sense.
Yeah, so AviClear is a laser that's been around now for coming up to about 3 years. And it's a laser that you fire at the skin 300 times to be exact on the face. And what it does is it reduces the size of your oil glands. If your oil glands are smaller, you produce less oil, your pores don't get blocked. And if your pores don't get blocked, the bugs that live on your skin have got nothing to act on to create deeper inflammatory breakouts. So ultimately, that's the mechanism of action. And up until about 3 years ago, we didn't have any external device that was able to do that. So that says a lot about technology, laser, and how far laser medicine has moved in the last decade.
It really does. And talk to us a little bit about the scarring as well, because obviously you sort of touched on earlier that when the collagen loss sort of starts to step in, obviously scarring looks worse. So how can you look at somebody's skin or somebody with acne and tell whether they're going to scar and almost catch it and start sort of preventatively trying to treat that?
You absolutely can. So about 20 to 30% of people who suffer with acne or breakouts will get permanent scarring. And by permanent scarring, what I'm really talking about is not discoloration of the skin, it's indentation of the skin. So there are divots in the skin, really, is what we're discussing here. And in terms of who that's more likely, if you've got a family history of scarring, it's much more likely to happen. If your acne was more severe at diagnosis, it's much more likely to happen. If you have acne which, you've exhausted all of the other treatments and you need stronger treatments, you're probably more likely to scar as well. So it's the resistance level of that as well. So those are all of the sorts of things that we take into consideration. But what's interesting is a lot of the treatments that we use to tackle acne scarring are the same treatments that we use for anti-aging. And that's simply because all of those treatments lie on the premise of building more collagen.
I must say that sounds really fortifying as well, because it sounds like you're tackling your acne and also doing something preventative for your skin aging.
That's absolutely right. So a lot of patients, for example, they may not have acne scarring on their full face. They might have acne scarring just in their temples or just in a localized area on their cheeks. And what I don't want is a sharp demarcation, for example, with my laser from a treated and untreated site. So I would do a certain setting where the scarring is, but then on the rest of the skin, I'll be like, I'll fix your pores in that area. I'll do a little bit of anti-aging in that area because actually your T-zone's fine, or a certain other part of your face is fine. So not only can you blend and customize the treatments, but you can actually be really focused on, okay, so this is the medical bit I'm fixing, but this is the cosmetic bit I may as well fix at the same time.
It's so nice that you can almost give that value add to the patient as well. You and I were talking when we met recently about almost how wild people's expectations are now about the end result they're going to get from these treatments. I think obviously driven by social media, AI, all of these things. But it's hard, isn't it? You can never quite predict how the skin is going to react. So having this multi-modality approach is really quite intelligent.
I think it's practical as well, because the truth is you can't speed up skin's physiology. So any treatment that you do that is going to build new collagen will physiologically at least take a minimum of 12 weeks. And the problem is that we live in a digital culture where everything happens so quickly. You see a before and after and you think, oh, well, that must have been like a week before that before and after. So one of the things that we have to be so careful about in clinic is to repeatedly say, it's not even going to look remotely good until 12 weeks. At the end of month 1, you're going to wonder why you bothered doing it. You might still feel that way at the end of month 2 as well. But from month 3 onwards, that is when that collagen will start to rebuild, and you will continue to see results from that from month 6 to month 12. But I think a lot of that is about education.
Education, I think, just having that awareness of the psychology of the patient as well, and what they're going to be waiting on tenterhooks for, and how long they can wait for it. Speaking of psychology, how does mental health fit in? Because there's evidently a huge link between skin and mental health, and obviously we know that a lot of medications, things like Roaccutane, have had sort of, reported or lesser reported side effects on things like mental health. So how do you navigate that conversation when it's the male patient and they're concerned about their skin?
It's much harder with the male patients. Men are not very good at talking about their mental health, are they? Despite the fact that we keep telling and hearing in the media how it's all getting better. It's not. And I think the only way that I find works for me is being direct about it and just directly saying, is this stopping you doing anything? Is your skin making you feel like you can't do X, Y, or Z? Is it affecting your ability to work, to wear certain clothing, to date? All of those things. Because I find that if you don't ask, they won't tell you.
And that's interesting, actually. It's the things that it's preventing you from doing versus how you feel when you potentially look in the mirror. I think that's when you can really measure the effect that something's having on somebody's quality of life.
Yeah, I agree. I think everybody deserves to look in the mirror and like what they see. And I think that's what we should be trying to work towards when we do anything in clinic.
100%. And I just want to sort of finish by touching on the rest of the body, because obviously we've been very face-focused in our conversation tonight, but skin is the largest organ. It does cover our entire body, so it makes sense that it's not just the face that we're looking at and being concerned by. What are the sort of more body-focused, physique-focused treatments that you're also offering and that you're seeing be really relevant to your male audience nowadays?
So it's funny, actually. So probably the most popular male treatment that we have is a treatment called Pure Impact. And Pure Impact is an EMS device, so it's a muscle building device. This is not a fat loss device. Because one of the things that I find that's quite interesting is women want to shrink themselves, but men want to be strong. They want to be big. So this is a device that you can use alongside training. So if you are somebody that is already doing a lot of exercise, I think it's a bit useless for people that aren't, but it's good if you train already to build muscular strength. It can be used on your abs, your quads, your hamstrings, your biceps, your triceps, your back and your shoulders. And the idea is that you are essentially, and I'm sure we'll be talking about this kind of stuff later, EMS technology has been around for a long time, but the idea is that muscle really is a longevity organ, It reduces inflammation, it's a sink for insulin, and as we get older, we need to hang on to that skeletal muscle mass for healthy aging. We don't want to live long lives, we want to live long, healthy lives. We still want to be able to be mobile when we're like 70, 80, 90 years old, and muscle is a huge part of that. And Pure Impact is one of those devices that it can help you lift heavier, it can actually improve your balance and your posture. So
it's sort of rooted in the rehabilitation as much as it is the aesthetic, which is interesting.
So to me, it's not aesthetics, it's longevity.
Yeah, exactly. And you've got the new sort of version coming out, right, which sort of tackles all different various body parts.
You can do like every bit of your body. I'm on there the whole time.
I feel like I need to get onto that. Well, as soon as I can. What I find interesting, though, is that you're a very sort of fit and active person yourself. So I think it's quite unusual, actually, as a dermatologist to have that awareness, not only of the skin, but of the physiology of the body as well. You were saying to me that actually your practitioner who does the Pure Impact is a PT herself, which I love.
Yeah, and I think that makes a huge difference, because I think that if somebody is applying this device to your body, they need to understand the musculature, they need to understand placements, and they need to understand the importance of why you need to balance your posterior chain versus like your quads.
Yeah.
It obviously helps as well that I have a great trainer sitting in the front row as well that educates me a lot about this as well. But the truth is that absolutely, I think you actually have to understand the muscle. It's not an aesthetic device.
Yeah, exactly. Well, I think that's a really exciting point that we've got to with sort of aesthetics, with sort of medical dermatology as well. We're not just seeing these devices as some things that are going to make us look differently on the outside, but they're going to make us feel differently as well. I think that's really key. Amazing. Thank you so much, Anjali. Any questions for Anjali? She'll be here, I hope, at the end, so we can ask her those. Our next speaker is Dr. Sohère Roked. I've already introduced her and she's introduced herself, but she's highly regarded when it comes to supporting the body, not only through hormonal optimization, but also through mindfulness techniques, also through sort of things like gut health and supplementation as well. So I think we're going to have a deep dive into all of those. But Sohère, as an integrative health medicine practitioner, who are the men that are coming to see you and what are they sort of seeking when they find their way to your door?
So the men who come to see me often come normally for hormone balance, and it can be just a vague sense of I'm not as energized as I used to be, I'm a lot more tired, I don't have the energy to go to the gym in the way that I used to. I'm not seeing the results I used to. My mood is quite flat. A lot of people come in if their mood isn't particularly good as well, and they're wondering if hormones are playing a part in that as well. Sometimes I see people who want to look at their gut health as well. So they're having some sort of gut symptoms, could be a change of bowel habit, or bloating, or reacting to certain foods. I think they're the main reasons people come to see me.
It's interesting. It sort of sounds like life is sort of carrying on an even keel, and then suddenly something shifts, and that's when we're sort of prompted to actually seek help. What does that initial consultation with you look like?
So people come in, like Anjali said, men aren't always as willing to blurt out every single thing that's going on with them.
Have to unpick.
Yeah, this is asking the right questions as well, and asking about sleep, mood, productivity, and what's important to them, like what's changed to make you come through my door, essentially. How long have you been thinking about it, how long has it been happening for, and yes, just getting a feel for their lives, what they do, how busy is their work, what's their family life like, their social life.
It's so important, isn't it, to have that sort of overview, that 360-degree sort of awareness of what makes the patient tick. So I suppose that helps you to be more nuanced in your approach, and probably sort of things like diagnostics that you do. And what sort of a role do diagnostics play? What sort of at what point does the testing come in, I suppose?
So it's really important. I wouldn't prescribe testosterone to a man without doing testing. I need to see what the actual levels are. I need the data. That's really important. But I don't just want to look at the testosterone. I want to see what are the kidneys and liver doing. Will they be able to process what I'm giving them? What's going on with their blood count, because taking testosterone can push up a blood count, so I need to see what's happening there. I need to see the role of the other hormones as well, certain vitamins and minerals and things as well, because it's a whole picture. Maybe you're really tired because your iron is 0 or your vitamin D is 0, and actually your testosterone's amazing, and if the other cofactors were there, you'd feel absolutely fine. So for me, it's about looking at that whole picture, and of course also finding out about diet, exercise and stress. They're like 3 biggies. How much sleep do you get? Are you on a plane every week because you travel internationally for work and you're always jet lagged? All these things are really important, so I need to see the whole picture.
I think it was you that actually said to me, sort of think of hormones like more of a symphony, sort of an orchestra. We have multiple, men and women, different hormones, and actually it's not about any one of them being the priority or being supercharged, but really ensuring that everything is playing sort of in tune and collectively together to really sort of enhance things. But interesting that you sort of picked up on diet, stress, things like this, because evidently there are things that we can do ourselves to influence this, and maybe we can talk about that a bit later. What's the correlation between sort of a testosterone and a cortisol? Because that's another thing that's obviously really driving that sort of sense of imbalance and fluctuation in the male patient.
Yeah, so often if someone has a high cortisol, it can have a negative impact on their hormones, whether they're a man or a woman. So it's important to find out about stress and how they manage stress. And stress isn't just always emotional, sometimes it's physiological stress. So for some people, they might be doing too much exercise. So how do they feel after exercise is an important question I ask. Are you absolutely wiped out and you can't do anything for 2 days? Maybe the type of exercise you're doing is too intense for what's going on in your life at the moment. So that's important to find out. And I do also measure cortisol as well. And cortisol, it follows a very similar pattern to testosterone. So it rises over the morning and then should drop down in the evening. It's what our 9 to 5 workday is based on. So it's important to have a look at that and find out what's going on throughout the day. But just to say, as much as the levels are important, and they are very important, I'm also holding in my mind why that person has come in, whether it's sleep, energy, mood, concentration, focus. So whatever route we need to get there, I want them to have an improvement in what's going on for their life.
No, that makes perfect sense. And I think that's what makes you so unique as a practitioner as well, keeping that full patient approach always front and center of your mind. When it comes to testosterone replacement therapy, or TRT, how do you go about prescribing it? What does that treatment actually look like for the patient?
So if the levels are indicating and it's correlating with the symptoms that yes, some testosterone would be potentially helpful, generally there are 2 main options. There's topical, so gels and creams, or there's injectables. So it really does depend on the levels. It also depends on patient preference. It also depends on lifestyle, because maybe it's not going to be convenient to have an injection once a week or every 12 weeks or whatever it is if someone travels a lot. So it's very much looking at that fine balance. What I am finding is that sometimes levels are suboptimal, let's call them, not completely deficient, but suboptimal. And maybe they don't need a massive dose of testosterone. Maybe we could use a small amount topically daily to help to balance the levels. That's
almost
also an
a
option.
microdosing approach.
Yeah, not quite microdosing, but yeah, like maybe a bit lower than the average that you get from your GP potentially. So that can be part of the way I look at things. And then the other thing is, when you inject testosterone, as a man, you normally completely shut off your own production. So that conversation is very important as well. Do we want to completely shut off your production? And of course, if you stop using the injections, there's things we can do to try and bring back the production, but it doesn't always work. So again, these are very important conversations to have, rather than just go, here's an injection, off you go, and go, all right, well, hang on a minute, there's lots of different options. What's going to work best for you at this stage?
Yeah, exactly. And if somebody doesn't want to take testosterone, are there alternatives? Are there natural sort of ways to increase testosterone production?
Definitely, we should be looking at diet and lifestyle and the amount of exercise you do and how much stress you have, and supplements can help as well. Things like zinc can help to boost production. Ashwagandha can help regulate cortisol, so if that's an issue, that can then have a positive impact on testosterone. Also, looking at things like fenugreek as well can be helpful. So there are different supplements as well. I don't always dive straight in. We can also look at all the other things going on first, if that feels more comfortable for the person I'm seeing.
Yeah, and I think it sort of circles back to that initial consultation, doesn't it? Understanding why the patient's there to see you, and almost what their limitations are, what they're prepared to do, how far they're prepared to push this. I assume for a lot of men, this isn't a sort of permanent sort of journey that they're on either. Maybe you can do it for a bit, sort of come off, and just until you've actually made those differences and you're noticing a difference.
Yeah, for sure. That can be a possibility. I mean, I'm prescribing for physiological health, so I'm not trying to get levels above what would be physiologically normal for them at that stage of life either. So I think that's always an important conversation to have as well. But I see good results with topicals, I see good results with injectables as well. So it's always about what works best for the patient, really.
Do you see any correlation between testosterone and weight management? You're obviously doing a huge amount as well, sort of very, very quietly, very reputably in the sort of field of GLP-1s and weight loss medication. Where does that fit into this picture? Because that's obviously seen a huge spike in male and female patients of late.
Yeah, and I do see male patients coming in specifically to talk about GLP-1 medication. And with any patient I see for that, I'm going to be asking them the same questions about diet and exercise and stress and how they manage all the other things going on in their life, because despite what you read in the press, it's not always a quick fix just to take some GLP medication and expect the weight to drop off it. Although I do see that it does tend to work better in men than women.
Oh, do you?
Yeah,
That's
I
really
do.
Interesting.
I think it's because of all the fluctuations women have if they're having a cycle and how things change week to week, whereas with men it can be a lot steadier. And actually, if a man puts his mind to it, takes the medication and is working out in the gym and also eating well, they get really good results. If I see a husband and wife, I will always say to the wife, look, be mindful, he may lose a lot more weight than you more quicker, so just be aware of that.
You're going to regret bringing him in as well, because he's had a biggie. That's very funny. And what about the side effects of the GLP-1s? Obviously, there's a lot of sort of noise, a lot of press around negative side effects, and I think that's important to touch on, but also a lot of sort of lesser documented positive effects as well that I think people are experiencing. What are your thoughts?
Yeah, I am seeing some really good results around things like cravings, just in general. So I saw a patient who's drinking 5 or 6 times a week, 5 or 6 drinks 5 or 6 times a week, and now has 2 glasses of wine a week, just because they don't feel like it anymore.
Yeah, I think the alcohol sort of dependency definitely drops from what I've seen and sort of read as well.
Yeah, and I see other patients who are like, well, I just feel like going to the gym more, the mental chatter has gone and I can get myself to the gym, I feel more motivated, I want to do more things. and that's always great to see as well, all the other positives that can come with it, not just the weight loss.
Exactly. I think the sort of reduction in inflammation, I think sort of long-term uses of the GLP-1s will be really interesting for us to look at, but I think, sort of just finding something, you know, whether it's the work that you're doing hormonally, whether it's with the GLP-1s, maybe it's just with stress sort of management, understanding those solutions and those tips and tricks that can help you get back to that more even keel. What do you advise to keep stress at a minimum? I know we sort of touched on a few supplements, but from a lifestyle perspective, sort of daily hacks, things that we can integrate into our day-to-day routines, is there anything that you sort of really see great results with?
So I always try to find the quickest, easiest thing, because I think if you're giving a stressed person a lot more things to do, that's not really going to help.
No.
So just simple box breathing can help. Breathing in for 4, holding for 4, breathing out for 4,
I always take deep
holding
breaths
for
when people
4.
start talking about breath work. I realise I haven't breathed this entire talk.
Just reminds you to breathe a bit, you know, And there's so many guided things out there. You can, 10 minutes in the morning or 10 minutes in the evening, or guided visualization can sometimes help. And I always try and say, right, I would call it net time, no extra time. So if you've got a commute in the car, what can you do on that commute, on the tube or wherever you are? Could you, instead of like scrolling on your phone or reading the news, potentially you might want to, read something a bit more uplifting or listen to some music that brings you a bit more joy, building in very small things, your lunch hour. Of course, we all have emails to do and work to do, but today, it was quite nice out, wasn't it? So I just went for a bit of a walk for 10 minutes, and saw some blue sky and felt a bit of sun on my face. And that can make all the difference, these little things that we do on a regular basis.
I love that. It's that sort of whole approach of working smarter, not working harder. And it's sort of not dissimilar to what Anjali said about, you don't need all of these multiple different skincare products. You almost just need one that sort of has everything that you need in it, and just being a bit more aware and mindful of our time and how we use it.
And if you've got time, go to a yoga class or something. But if you don't have time at the moment, then let's just build in a few little things that you can do.
The other thing you told me, actually, sort of just one-on-one, was delaying your morning coffee. And I actually found that to be really helpful in times where anxiety and sort of performance are already sort of front and center of your mind, just to sort of have a little break from the caffeine, so it's not the first thing that hits your empty system as soon as you wake up.
What can really help with that cortisol in the morning is getting some daylight straight away, even if it's through the window, so open up the curtains, don't sit in the dark room, let that daylight hit you a bit, and then do what you need to do and delay your coffee for at least an hour. If you can do 2 hours, even better. But just delaying that a little bit has a good effect on your circadian rhythm, and then it can help your sleep later in the evening as well, because sleep's so important for all these things too.
I feel like 1 hour is probably my maximum 2, and my emails would not be sharp enough. Finally, I wanted to touch on gut health, because I think we sort of mentioned that right at the beginning, because I'd love to sort of see how pivotal that is when you're treating the male patient, and what we can sort of do to support from a more holistic perspective as well.
So I'm always going to ask the question, about bowel habit and bloating and indigestion and any certain foods that, you feel these things with, because the gut's so important. And if the gut's not working well, we're not going to metabolize all these good things we're putting into our bodies, whether they're supplements or hormones. And, we need to know how to, the microbiome is really important for the way you manage your hormones and produce hormones and metabolize stress. So I want to find out what's going on there. And it might not be, an issue that you've suddenly had now. It could be a build-up. They say the microbiome might not be as good if you were born by cesarean section, or if you weren't breastfed. Things that happened really long time ago, and it's just good to be aware of these things. I'm going to ask the questions. I'm going to find out if someone needs probiotics or enzymes or further gut testing. So it's something I do like to talk about really with patients.
I think it's such an important part of that sort of overall holistic conversation, isn't it? Like you said at the beginning, it's almost really getting under the skin of that patient, understanding what makes them tick, and painting that bigger picture. And then I suppose off the back of that, knowing exactly what approach you're going to take, depending on what their sort of key concern is. Amazing. Sorry, that wasn't a question. That was just me sort of ramping up. You were like, is that a question? Am I supposed to say something? Thank you so much, Sohère. That was fascinating as always. And any questions for Sohère on anything hormonal, sort of lifestyle related, do let us know at the end of the talk. Thank you.
Thank you.
And so our final speaker is Dr. Sam Botchey, based here at Lanserhof at the Arts Club, but also, multiple different places across London. I've forgotten all of them, but safe to say he's very, very busy and very in demand. Sam, maybe we can start by sort of taking a dive into the men that come to see you and really what they're seeking when they find their way to your door.
You know, I was listening so intently there that I actually forgot I was going to have to speak.
So
That's good.
Yeah, men come to see me. They fall into two main buckets. Most people come with an injury of some form, so they, something that's stopping them doing what they really want to do, which can just be picking up their children or grandchildren, or it can be high performers in terms of not being able to do an activity and they've got an injury that's stopping them, or a chronic issue that's stopping them doing that. And the second bucket is performance optimization. So that tends to be people who come because they're just generally not feeling themselves or feeling like they are where they want to be in life at the moment. And, it blends from us physically performance, your body and your physical performance, up into psychological performance as well. And they're all interlinked, but most people tend to fall to one of those two buckets.
It's so interesting you say that, because as you were speaking, I was thinking, God, there's such a correlation between the physical, how that manifests, and psychologically, obviously, then what that sort of leads the patient to sort of feel or not feel that they can do. What are the sort of key things that you really see having a psychological effect when it comes to physical ability with patients?
It's probably actually the ability to exercise, the ability to do physical activity, and it's well studied, the benefits of physical activity on mental health, on performance, and we see all these top CEOs and people that are really high performing people, also the same people that are running marathons and doing really high level activity, and the correlation is clear that if you exercise regularly, you release so many hormones, BDNF and other things that really benefit your psychological health, benefit your ability to perform mentally as well. So it's actually the ability to exercise rather than it being a specific bracket within exercise.
That's super interesting. What's the starting point for you when a sort of male patient comes in for a consultation, and are you also using sort of diagnostic tools and testing in any way?
Yeah, I suppose much like as Sohère mentioned, we use that functional approach as much as possible. So when someone comes in with knee pain, for instance, that's only a bit of the problem. That's stopping them, and that's what they feel.
But actually there's a whole raft of issues that can come alongside that, and we really need to drill down into what might have led towards that pain and that ability, that inability of them to do the activity. So looking at their cellular health is really important, doing blood tests to make sure they haven't got an inflammatory load that might have led up to that point. A lack of strength in the joint itself, a decrease in the collagen health, a decrease in the protein structure, a decrease in the cartilage health. All of these things can be measured, and it's a big picture we look at. We talk about these like facets of aging that have happened. So, the 12 hallmarks of aging.
And if we look at all of them independently, they all affect the musculoskeletal system in some way. So when I look at a patient who's come in, who says, I've got really bad elbow pain or really bad shoulder pain, I look at all of those facets, and that can be anything from blood tests down to biomechanics, down to the degradation of their protein over time, and actually managing all of those individually is what really can move the needle for that patient. And they may not know it to start off with, but actually looking at the whole person maybe the root cause of fixing their knee.
That's fascinating, and it's very similar to obviously Anjali and Sohère's approach as well, but it strikes me that people are probably coming in to think they're having a quick fix for their knee that's giving them some grief, and actually there are so many more things to take into consideration. I mean, you must find that all of these things compound as well. People then can't exercise, then they put on weight, then psychologically sort of things dip and wane. You mentioned to me as well that you also sort of have a place for the GLP-1s and the weight loss medications in your clinic, almost just to get the patient, male or female, back to that place where they can sort of enjoy the physical activity and exercise that they used to.
Yeah, I mean, we're finding out more and more about GLP-1s, Ozempic, Mounjaro, and all of the rest, and new ones that are coming out. We're finding out more and more information that they might be these wonder drugs in terms of what they do. And we think about the weight loss, but there's metabolic health benefits to them as well, psychological health benefits that Sohère already spoke about. But actually, for my patients specifically, what I find is that it can really shift them into that category of not wanting to do exercise, not being able to do it because they're overweight, to actually now I want to do exercise, I've had my food cravings minimized, and my cellular health is improving at the same time. So, you know, it actually hits many of those buckets I spoke about in terms of the hallmarks of aging. So, utilising them, I think, is really important. I actually gave a talk last week. Was it last week? There's so many talks.
I don't know, it's all blowing into one this month.
Yeah, no, at the British Association of Sports and Exercise Medicine, and it was on GLPs. It's the same thing where as we're learning more about them, we need to be able to use the evidence to help our patients currently and not wait too long, because people are suffering now. So it really is trying to find ways to move the needle, and it may in the future be microdosing, it may in the future be long-term management of how to come on and off GLPs, but actually right now people can really benefit from some GLP medications.
It's interesting because a lot of it goes back to sort of motivation and sort of understanding what is going to motivate a patient to make that change and improve their health for the better. You touched on it in your introduction, but you work with a lot of professional athletes as well as sort of normal mortals like us. But you also said to me when we spoke offline that you treat everyone, I think you said, as an athlete of life, which I really liked.
Yeah.
Can you sort of dive into that a little bit
Well,
more?
I think when you look at professional athletes who do physical performance for a job, you realise that the peak performance requires you to basically have your whole life dedicated towards that. And because they're doing that, they're often always at their peak, and when something goes wrong, they're immediately on top of it. And I think when I see my patients, I tell them to think of them as the same thing, but their goal isn't to, win the Olympics or knock Jake Paul out in Miami. Their goal actually is to have a specific performance indicator that is relevant to them. And as I said, that might actually be, walking comfortably to work every day. It might be lifting your grandchildren up and throwing them and catching them without feeling the crippling back pain. It might actually be bending over without making that sound, but if they have a goal that they can attain towards, they need to attack it as if they were an athlete of life. And that's why I use that phrase, because, we all revere this word athlete, but actually we all need to do physical performance in some way. And if we attack that goal like these athletes attack theirs, we probably will get the same result. And that's why we need to be more forceful in telling people, this is so important. And, Anjali stole my line already with the muscle being the organ of longevity, but I can't stress it enough. Muscle is so important, for men and for women, but for men, it's a critical factor in how your whole system works. And if you can maintain the quality and strength of your muscle over time, you may not live to 130, but when you're 80, 90, you're going to feel like other people do when they're in the 40s and 50s, and that's what's critically important. Not how long you live, but how well you live during that time and how much you can do physical performance-wise.
Yeah, I love that, because again, it circles back to, fine, men want to build muscle, but it's not always for aesthetic reasons, or it shouldn't always just be for aesthetic reasons. There is sort of long-term health sort of benefits that come from this, and, running all through your body. Longevity, which you just touched on there, is obviously a huge buzzword in your industry, in all of our worlds now, in fact. But when you're actually working towards, I suppose, in simple terms, building a body that stands the test of time, what are the things that you're actually focusing on? Like, what should we all be doing to ensure that our bodies are sort of fit for purpose for as long as possible?
Well, you have to buy my book that comes out next year.
That was such a... I walked
but thanks for leading me into it. No, so I call it strength span, and we talk about lifespan, we talk about health span, but actually more important is strength span, and that's strength that we talk about, and I use that word as a buzzword because I think men particularly attain towards it, but we need to look at all the facets that can improve our strength. And it's not the simple thing you think about. It's not just the muscle quality. Muscle health is really important, but it's also your joint health, your mobility, your cardiovascular health, and your VO2 max, or your ability to produce a lot of cardiovascular long-term ability. These are the things that we try and assess. And then we look at your metabolic health, or your metabolic strength, your cellular health, or your cellular strength. And then we look at also at emotional and your emotional strength, and it's all of these factors that can affect how well you live and how well you perform. why do elite athletes have a psychologist behind them? Why does every football team have a psychologist in there? You know, these are all things that can improve your physical performance, and it all works in tandem together. So these are all, I assess all of these things in tandem, and we essentially create biomarkers or numbers associated or factors associated with each one. And we look at them intently and try and manage each and every single one. And it might be that, oh, his strength is really good when we do the testing downstairs, and actually his cardiovascular ability is really good. But why isn't he performing the way he wants to perform? And then we do a psychological health assessment. We notice that that's where he's dropping down. And this is what we use. We actually have to measure as much as possible. And without measuring, you can't really fix anything. If you haven't measured to where someone is, you won't know if they've got an improvement at all. So this is why we measure so intently, because it's our way of finding out if what we're doing is working.
I was hoping for a more simple answer, like we could go into the gym and you could do this exercise and this exercise, but I appreciate none of this stuff is a straightforward fix, is it?
It's also personalised. So if you were to, go to someone that says, this is the way that you can be better, and, we see it in all sorts of books and all sorts of TV programs, and, if that was the case, we wouldn't need great PTs, we wouldn't need doctors, we wouldn't need any of that. It needs to be personalised to that person, and not everything works the same for everyone, and we all have different stresses in life. I talk a lot about testosterone, and I manage testosterone as part of this. Your hormonal strength is one of the things that we look at. But over time, over the past 50 years, the number that we use for a normal testosterone has dropped over time, and individuals aren't in control of that.
So men are actually sort of less testosterone laden.
We're less men than we were 50 years ago. It's not our fault in that sense. We've got toxins in the environment. We've got a poor dietary health across time, a more obesogenic environment. We've got wonderful smelling perfumes, but at the same time, these are the things that are killing our hormones. They're all working in tandem to reduce that over time. And when you go to a lab and they tell you that this is the normal testosterone level, they've taken that from a subset of people that have gone to the lab and taken their testosterone levels.
So actually what they're measuring it against isn't even sort of the optimal.
It's not even the optimal. If we really wanted to do that, we'd measure all the people that are super healthy, and then we'd be like, oh, that's a normal level, that's the level we attain to. So when I do a testosterone level, actually we try and base it more off the symptoms as much as possible. And sometimes that might even mean that they need to be a bit super physiological in their numbers, not so much so that they're getting the bad side effects or the washouts, but actually so that they're feeling like vitalitas. You want to feel like you're strong in your 40s and your 50s and your 60s, and you don't want to feel diminished, as a man. I would, posit to say, because there's less women in the room than there was in my other talks today, that it's really hard to be a man these days. It's really, really difficult, because it's you're expected to, in some respects, be a provider for a lot of the time. You're expected to be strong, but you're also expected to be emotionally strong at the same time, and able to do the things that we never were expected to do in the past. So we're blending into a scope of practice that is really pressurized for men. And the only way we can do that is really by opening up and talking about in events like this.
It's very interesting, actually, that you've sort of drawn that connection between, obviously, sort of modern life, the expectations placed upon men emotionally, physically, in terms of providing and whatnot, and then also sort of thinking about, that there is less testosterone, and men are sort of struggling with that so much more. I think, obviously the way that society has changed and shifted and evolved has obviously played a role. So I think that's why it's even more important that, like you said, we have these conversations, solutions like all the ones that you're sort of talking about are really broadcast out there so that people can find that way to get back to a more even keel and feel more like themselves. Can we quickly touch on the regenerative stuff you do as well? Because I think that's really interesting. You're doing a lot in the world of PRP, HA, and even stem cells now, which is obviously the future of a lot of your world.
Yeah, I think the treatments we've had are a lot of attempts at quick fixing for a lot of joint problems and a lot of health problems. many of the people in the room would have had a steroid injection into a joint or something of the sort, but we now know that, as the Americans say, that's short-term magic, long-term tragic. These are things that will help you now, reduce inflammation now, but are preventing your body from doing the thing that actually wants to do, which is heal. So we have better options, and platelet-rich plasma, or PRP, is one of those options. We use it a lot now in sports medicine, for tendons and for joints. But we also use it in aesthetic practice as well. And these is a regenerative way of your platelets to enhance the growth factors in an area and really stimulate its own healing. And then we come on to stem cells. Now, stem cells have been around for a long time, but it's only really in the past 5 or 10 years that we've been able to harness the power and ability of them. And as time goes on, we'll be able to regenerate the joint health, regenerate cartilage, regenerate tissue that has been diminished. And stem cells are these tiny little cells that can basically blend or move into becoming anything. That's bone, cartilage, fat, things that we might need, skin. And this is how they grow things in labs, but actually we've never found a way or an ability to do that within the human self. And now that we're learning how to do that, I think really this is how the regenerative push is going to be moved forward.
So we're on the cusp of that at the moment.
Yeah, I think there's so many clinics out there that are promoting stem cells. You do have to be a bit careful because not all of them are actually doing stem cells. They're just saying that, and we all, if you took your blood right now, they'd have some stem cells in it. If you took some fat, they'd have some stem cells in it. But actually culturing them specifically to be able to do what we say to do and regenerate into that tissue, that is where it's very difficult, and this is what we're on the cusp of at the moment.
I think it's interesting. That's where you have to see a specialist who's really going to guide you down the right path to doing these things properly. When it comes to sort of looking ahead, what are the things that men can be doing from home to really look after their long-term well-being?
I think it's much easier to tell men to get to the gym and to do strength training. I've never found difficulty in convincing a man that that's what they need to do, but much more than that, I've found difficulty in telling them to do mobility training, things.
Like, it's a bit boring.
Well, yeah, it's a bit boring. It's also very difficult. I think when you do strength training, you get immediate feedback. And you often, the next time you're a bit stronger, and the next time you're a bit stronger. It takes a long time to improve your mobility. And because of that, men tend to neglect it and actually depreciates much more quickly as well. So, that bending over, that you're making that sound over, that it's not strength that's causing you to do that, it's mobility. So, and actually in terms of protecting your joints, mobility is actually much more important than strength in that manner. So, that's probably the main thing I would say. If you can do 10 or 15 minutes a day of mobility, that could change your life.
What's a good example of us doing 10 or 15 minutes of mobility exercises? What are they? So someone who hasn't been in the gym for like a year.
So for instance, brushing your teeth, I find when you're doing the mundane tasks that you always have to do, fitting in a little bit of mobility whilst you're doing that can be critically important. Let's say you're doing the washing up, just bending over and stretching, like in between every glass you wash or every time you put something in the dishwasher can make a huge difference. Squatting whilst you're brushing your teeth sounds ridiculous, but standing on one leg whilst you're brushing your teeth, these are all mobility and balance exercises that can really improve you in the long term. And I found great improvements in people who had just said, can you just do a single leg squat whilst you're brushing your teeth as many times as possible, and that can often get rid of knee pain.
That's so interesting. It's like what Sohère was saying about the sort of habit stacking approach as well, just integrating these things into day-to-day life.
Yeah, and I suppose the same thing would be said about the second thing that I think men should do, and that is talk. Have some form of connection. And as much as I talk about physical strength and mobility and health, actually having a community of people you can talk to, whether that is a mate you haven't spoken to in a long time or the neighbour down the road that you very rarely get to speak to, creating a form of connection can equally improve your physical performance much more than and that's why we have these psychologists in house and we refer to them, is because actually that's one thing that's really neglected by men for their general mental health, but also for their physical performance.
I think I said this to you when we were speaking just before this event. We did another panel, and there was a longevity focused male practitioner, and he said that once one of his female patients brought in her husband, and she was just like, tell him to stop going to the pub. Every week he goes with his friends to the pub and it's driving me mad, tell him it's bad. And he was just like, no, this is the best thing this guy can actually be doing, because he's got that outlet with his friends, and that's such a sort of pivotal part of your overall well-being, isn't it?
Well, yeah, I think prescribing lad holidays is vitally important, and it's actually the first thing I write on my scripts is that you know, and we lose connection so easily. You know, there was a radio presenter recently that spoke about how he hadn't had this holiday with his mates for a long time, but every year he looks forward to that more than anything. And I'm not saying you should look forward to it more than your family time, but certainly you do need that connection, and often it's male connection, but any connection at all can really enhance your long-term outlook.
I think that's such a nice note to end on, prescribing of lad holidays. I'm not going to mention that when I get home. Not doing me any favours. Thank you so much, Sam. Any questions for Sam? We can come to those shortly. That very much does bring us to the end of this evening's conversation, and I found that completely fascinating listening to each of you, and I feel like there were so many parallels that we were sort of drawing and that you were all sort of drawing with one another, but at the same time it sort of feels like we've barely scratched the surface of men's health as much as they're, we were talking about skin, about hormones, about physical optimization, but there's still a lot that I think needs to be spoken about. So I'm really grateful for everyone joining us today and helping us share this conversation, because I think it's an important one, not least where the physical and the psychological all collide. And so thank you. We do have time for a few questions if anyone would like to ask anything of our panelists. Otherwise, I do believe they'll be here for a little bit longer. So feel free to ask away. Oh no, we must have answered absolutely everything. Well, do come and chat to them afterwards, because they're all absolutely brilliant and fonts of knowledge in their own right. I think that's all from us. All that I have to really say is a big thank you to everyone who came. Thank you for coming and supporting. It's been amazing to have you, and hopefully we'll see you at more events. Our next one is actually, sadly, not until 2026 now, but it's our Beauty Triangle Festival, which is a full-day immersion, panel talks, more experts, consultations, treatments, wellness therapies, you name it. So come along and check that out. I think our Black Friday offer is still on, isn't it? Yes. So you can make the most of that. Thank you as always to Lanserhof for hosting us so beautifully. You guys outdo yourselves every single time. And a big thank you as well to the Y Code for very generously providing the amazing mattifying moisturiser that everyone is going to take home. So we can add some SPF and some retinol into that, and then Anjali will be very happy with us. And then finally, a huge thank you to our Beauty Triangle for being such brilliant speakers and really sort of raising the bar when it comes to discussing male health. Thanks.